Balancing the Pressures, a study published by NCEPOD in 2020, examined the care received by children and young people receiving long-term ventilation in the UK. This presentation has been produced for commissioners of LTV services and aims to highlight some of the recommendations that will help to deliver improvements in the safe and efficient delivery of LTV care, as well as better patient and carer experience. The LTV pathway can be extremely complex, with a young and vulnerable person at the centre. To understand how LTV care could be improved, we conducted surveys, interviews and focus groups with patients, carers and health and social care professionals involved in the LTV pathway. We also reviewed the clinical records of people treated with LTV. A small amount of data and a number of quotes from interviews and focus groups are presented. Service users told us that in more than 1 in 3 cases they did not receive the full range of health services they needed. Health and social care professionals identified that LTV services had substantial room for improvement. In particular, they considered that commissioning arrangements could be improved in the majority of cases. The impact of the current approach to commissioning on service users was striking, and this was also reflected in the views expressed by healthcare professionals. Equipment problems related to standardisation were identified by 1/4 of lead clinicians and in a similar proportion of community services. This created serious operational problems for LTV services and anxiety for service users and carers. A disconnection of services at the transition from children's to adult services was also identified. This is of particular importance as the number of children receiving LTV who reach adulthood is increasing rapidly. In order to provide young people using LTV with the service they need, NCEPOD made 12 recommendations. These include the need to ensure formally contracted and standardised integrated care pathways for LTV services. The report also recommended that planning for transition from children's to adult services is built into these care pathways, and that arrangements for the purchasing and servicing of equipment, including consumables, are also standardised. More details of the report, a full set of recommendations and additional resources are available and free to download on the NCEPOD website at www.ncepod.org.uk.